In an active lifestyle, body odor can sometimes get the best of you, no matter how hard you try. That's why after you shower, you should reach for Dr. Mist, an award-winning product that's scientifically proven to eliminate body odor and keep clothing and footwear fresh for up to 3 days. Feel confident. Feel fresh. No matter the occasion. Dr. Mist works long after you've showered. In stores now.
Hi there, welcome to Vitamin Junkies. I'm Jennifer Lyle.
I'm Dr. JJ.
And we're addicted to good health. Just in case you're wondering who you're watching, I am the mother of 2 boys, and I've had a personal interest in health and wellness for the last 6 years. And I've partnered with Dr. JJ to bring you this show.
Actually, her 2 boys were just in here today, very well behaved. I'm Dr. JJ. I'm a naturopathic doctor. I'm a public speaker, and I'm a researcher.
Today we're going to talk about diabetes. But before we get to that, part of our segment is, what's JJ taking today?
Okay, today JJ is taking a multivitamin. Yes, I know, a multivitamin. A lot of you take these at home. Many reasons to take a multivitamin. Diabetes is one of them, which we'll get to shortly. But a very important reason is that we don't always get all the vitamins and minerals we need from our food. So a multivitamin is a good way to top up. So insert in mouth, drink a glass of water. That's it.
Perfect. So our questions for diabetes. Let's start from the top. What exactly is diabetes?
Okay, so diabetes is a disease when you have too much sugar in your blood, and it causes a lot of complications, heart disease, loss of nerve sensation, blindness, etc.
Wow. What are the different types? What are the different types of diabetes?
There's type 1 and type 2 diabetes. So type 1 diabetes is the type where you don't have enough insulin. So what you have to do is you have to inject insulin, like you see those people with the needles having to inject themselves. And then there's type 2 diabetes, which is late onset diabetes, is when the sugar in your blood doesn't get absorbed into your cells. The cells become resistant to insulin.
So my dad was diagnosed with diabetes when he was probably in his 50s, and he was overweight. So would the weight have been one of the contributing factors to that?
Oh, yeah.
Or hereditary, because it's also my grandma also had it too.
Yeah, there's definitely a lot of risk factors for diabetes. So there's being sedentary, lack of exercise, being overweight, genetics. What we found in late onset diabetes is that the more obese you are, the more abdominal body fat you have, it actually increases your insulin resistance. So your cells don't respond as well to getting sugar out of your blood into the cells.
So you mentioned that you have to inject your cells, but
only type 1.
Only type 1? Okay, so could type 2 diabetics regulate their insulin just with diet? Is there a special diet that they should follow?
Oh yeah, definitely. One of the main issues you find with type 2 diabetics is that they could entirely control their condition through managing their diet.
Really?
So avoidance of simple carbohydrates, moving more towards complex carbohydrates, good lean proteins such as fish and lean meats, poultry, lots of vegetables, definitely through controlling their diet. Type 2 diabetics should have a tight control in their condition.
So you mentioned simple and complex carbohydrates. What's the difference?
Okay, so a simple carbohydrate would be something like a bagel. Or white bread, or a muffin, or pasta, or white rice. Okay, so simple carbohydrate in your body gets turned into sugar right away. It's a very, very quick metabolic reaction. So right away, you have a simple carbohydrate, you eat it, and your blood sugar goes up just about instantly. Okay, if you have a complex carbohydrate, so say more of a multigrain bread, brown rice, etc., something that's more fibrous, something that's more of a true grain, slower to digest, instead of spiking up right away, it's a lot more gradual. So your body, through the pancreas and insulin release, is better able to manage these blood sugar spikes. So it makes it a lot easier for you to control your blood sugars.
Oh, very good. Now, what are some naturopathic approaches that people can use to treat diabetes?
All right, so there's a number of things you can do. There's acupuncture, there's diet, which I just talked about, there's supplements. We could start, well, diet I already talked about. I think basically moving away from carbs. I think all diabetics, if they minimize their carbs, no pasta, no flour, no bread. These are usually the main problems diabetics have. There's a lot of supplements too. I just talked about the multivitamin, for example. What we found is people that have low levels of niacin, which is vitamin B3, and low levels of magnesium, they're more prone to diabetes, so having a multivitamin would be very good. There's chromium, which is a really good supplement. There's alpha-lipoic acid. There's cinnamon. There's bitter melon. There's ginseng. There's a lot of products out there to help you balance your blood sugar.
Wow, so there's a lot that you've just shared with us. It sounds like it's really important for someone to work with a naturopathic doctor.
Got a lot of love to give. I got a lot to share.
Thank you so much. But it's important to work with a naturopathic doctor then, isn't it, to really tailor a program that's right for them?
Oh yeah, definitely. Because as the large number of diabetics are already on medication. So as you start to lower your blood sugar, and if you start taking these products, you want to make sure that your blood sugars don't drop too fast. And the last thing you want is you don't want to get episodes of hypoglycemia, so that's when you have low blood sugar. And that could cause fainting, that could be very uncomfortable. So obviously you want to control these things. And something all diabetics should do is have a blood sugar monitor. You've probably seen when they stab their finger and then they check it.
Yes.
Check it between 3 and 5 times a day after your meals, waking up first thing in the morning and before going to bed, so you have an idea in terms of how your blood sugars vary throughout the day. But definitely they should be followed, I agree, by a naturopathic doctor and a healthcare practitioner. Yeah.
Fantastic.
Yeah.
And if you are looking for a naturopathic doctor, you can find one through the link on our website for Find a Practitioner. And do you have any closing thoughts on diabetes that you want to share with our viewers?
Closing thoughts on diabetes. Go to our website, and if you have any questions, go to www.askdrjj.com.
Yes.
And also please go to vitaminjunkies.com and join Vitamin Junkies Anonymous. We would love to have you join our team. All right.
Fantastic. I'm Jennifer Lyle.
I'm Dr. JJ.
And continue the addiction to good health.
Continue the addiction to good health.
Do 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 do. Do 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 do. Do do do.